urgent question. Heidi Alexander.
Thank you, Mr. Speaker. To ask the Secretary of State for Health if he will make a statement on the junior doctors' contract negotiations.
Where is he?
Mr. Speaker, I would be delighted to update the House on the junior doctors' proposed industrial action. This government was elected on a mandate to provide for the NHS the resources it asked for and to make our NHS a truly 7-day service. The provision of consistent clinical standards on every day of the week demands better weekend support services such as physiotherapy, pharmacy and diagnostic scans, better 7-day social care services to facilitate weekend discharging, and better primary care access to help tackle avoidable weekend admissions. But consistent 7-day services also demand reform of staff contracts, including those of junior doctors, to help hospitals roster clinicians in a way that matches patient demand more evenly across every day of the week. In October 2014, the BMA withdrew from talks on reforming the junior doctors contract and, despite the government asking them to return, did not start talking again until the end of November last year, in talks facilitated by ACAS. Throughout December, we made very good progress on a wide range of issues and reached agreement on the vast majority of the BMA's concerns. Regrettably, we did not come to an agreement on 2 substantive issues, including weekend pay rates. So following strike action last month, the Secretary of State appointed Sir David Dalton, one of our most respected NHS chief executives, to take negotiations forward on behalf of the NHS. Further progress has been made under Sir David's leadership, particularly in areas relating to safety and training. However, despite agreeing at ACAS to negotiate on the issue of weekend pay rates, Sir David Dalton has advised us that the BMA has refused to discuss a negotiated solution on Saturday pay. In his letter to the Secretary of State last week, Sir David stated, "Given that we have made such good progress over the last 3 weeks, and we are very nearly there on all but the pay points, it is very disappointing that the BMA continues to refuse to negotiate on the issue of unsocial hours payment. I note that in the ACAS agreement of the 30th of November, both parties agreed to negotiate on the number of hours designated as plain time, and I hope that the BMA will still agree to do that. The government is clear that our door remains open for further discussion, and we continue to urge the BMA to return to the table. Regrettably, the BMA are instead proceeding with strike action over a 24-hour period from 8 a.m. this Wednesday. Robust contingency planning has been taking place to try to minimise risk of harm to the public, but I regret to inform the House that latest estimates suggest that 2,884 operations have been cancelled. Mr. Speaker, I hope honourable members from all sides of the House will join me in urging the BMA to put patients first, call off their damaging strike, and work with us to ensure we can offer patients consistent standards of care every day of the week.
Heidi Alexander.
Thank you, Mr. Speaker. There is so much that could be said about this dispute, it's hard to know where to begin. So let me just ask the Minister 4 simple questions. 1. The Health Secretary says that his door is open to further talks with the BMA. What does this mean? Specifically, can the Minister envisage a new contract where the definition of plain time working at weekends applies only to a Saturday morning? 2. If a negotiated solution to a new junior doctor contract can't be found, will the Minister today rule out imposing one? Does he not see how harmful imposition would be to patients, given its impact on staff morale, the risk of a protracted period of industrial action, and the implications for future recruitment and retention? 3. Can he confirm that the pay protection offered to 1 in 4 junior doctors means that those doing the equivalent jobs in the future will be worse off? Shouldn't we value the junior doctors of tomorrow as much as we value those of today? And finally, 4, Mr. Speaker, throughout this dispute, ministers have repeatedly conflated the need to reform the junior doctor contract with their manifesto commitment to a 7-day NHS. Can the Minister name a single chief executive who has told him that the junior doctor contract is the barrier to providing high-quality care 24/7? If junior doctors are the staff group who have to change their working patterns least to deliver this, which other groups of NHS staff will need to have the definition of unsocial hours changed in their contracts in this Parliament. Mr Speaker, in the last year, the Health Secretary has implied that doctors don't work weekends. He's insinuated that juniors are somehow to blame for deaths amongst patients admitted on Saturdays and Sundays, and he's insulted the profession's intelligence by telling them they've been misled by the BMA. If he was here, Mr Speaker, I'd ask him if he regrets the way he's handled this dispute, but he hasn't even got the nerve to turn up. Mr Speaker, no one is saying the existing junior doctor contract is perfect, but speak to anyone in the NHS and they will tell you that this whole episode has been an exercise in using a sledgehammer to crack a nut. It's time for the government to do what's right for patients, for staff and for the NHS.
Thank you, Mr Speaker. The Honourable Lady asks where to begin. And I will say this to her. Where we begin is a promise made to the electorate to deliver 7-day services so that we can make care more consistent through the week and thereby bring down the rates of avoidable death. That is the aim of this government and is one that they have pursued in the previous coalition guise and in this current government for some years. And the junior doctors contract, the negotiations that have been going on for some years, has been framed partly in that respect during that time. Now, she asks a number of questions which I shall answer directly. The first is that she asks whether the door is open and whether the Secretary of State is willing to see further talks. Of course they remain open through this entire process. Back from the summer when the BMA made a principal point on not returning to talks, we have asked them to come back to the negotiating table time and time again. I have done so personally, as has the Secretary of State. So the door does remain open, and I hope that in the coming days those contacts will continue up until the strike. She asks if there is discussion to be had on Saturdays. The Secretary of State has made plain all through this that every aspect of the contract is open for discussion, but what is not up for discussion is the ability of hospitals to be able to roster clinicians on a consistent basis through the week. Now, the one group of people who are refusing to negotiate on Saturdays or on anything to do with plain time extension is the British Medical Association, who, despite their assurances, in fact their promise at ACAS at the end of November that they wished to discuss this issue, have now refused to Sir David Dalton to do precisely that. So we are left at an impasse where I'm afraid the one item left to discuss, which is Saturdays, they are refusing point blank to open, as they call it, on an issue of principle. For us, the principle is patient safety, and that is why we will not move. The second point that she asked about was around the introduction of a new contract. At some point, this government needs to make a decision. We have extended time and again at the point at which we will introduce a new contract, precisely so that we can give time for talks to proceed, even though the BMA refused to discuss this for several years in a disjointed manner up until this point. But at some point, we will have to make the changes which are necessary in order to get that consistency of service over the weekends. We cannot delay this any longer. No health secretary, no minister of health could stand in the face of the many academic studies which have shown an avoidable weekend effect and say that nothing should happen. Now, of course, this should be done in concert with other contract changes, with changing the availability of diagnostics and of pharmacy and other services. It is part of the piece. We have always said that. But it has to be done at some point, and that point is fast approaching. She asks whether imposition would be harmful to patients. I ask her to consider whether avoiding changing rostering patterns so that we eliminate the weekend effect would itself be harmful to patients to the numbers of several thousands a year. She asks around pay protection, which we have urged the BMA to put to their members, that we made clear right at the beginning of this process, and they I'm afraid, willfully misled their members about the pay offer that we put on the table. And I would ask her, therefore, to be careful in what she says, because for this cohort of junior doctors, this is a very good deal. And for those coming into the service, they can be assured a kind of quality of contract which the current cohort have not been able to benefit from. A reduction of the maximum number of consecutive nights down from 7 to 4. A reduction in the maximum number of consecutive long day shifts down from 7 to 5. A reduction in the maximum consecutive long late shifts down from 12 to 5. A reduction in the maximum number of hours that one can work in a week down from 91 to 72. Considerable improvements in the contract which will protect the safety and working practices of future generations of junior doctors. But I will just remind the Honourable Lady, when she wrapped up her remarks, when she asked whether we had any regrets about the way that this has proceeded. We do have regrets. We have regrets that the BMA willfully misled its members at the beginning of this process, making them believe that there was going to be a cut to pay and an increase in hours, neither of which was true. We certainly regret the fact that the BMA refused to talk to us for months on end, where many of these issues could have been dealt with at that time. And we certainly regret the fact that the BMA has gone back on its promise to discuss plain time hours, a promise made at ACAS which they have now reneged upon. I'm afraid that in dealing with the BMA, we have not been able to address those matters which are most important to doctors, which is to protect patient safety. And that is why, in the end, we will have to come to a decision on this contract for the betterment of patients and the consistency of clinical standards through the week.
Dr. Sarah Wollaston.
Mr. Speaker, under the current contract, too many junior doctors are being forced to work excessive hours and are overstretched during the hours that they're working. Could the Minister, having set out that those hours will be reduced, reassure the House about what measures are going to be put in place to make sure that managers don't let that slip and that we don't return to the days of overworked junior doctors?
I thank my honourable friend, and she is right to say that new measures have been introduced in this proposed contract. A new guardian role, which was proposed by NHS employers, will help to protect the hours of junior doctors within individual trusts. This has been a point of success in terms of the negotiation between the BMA and NHS employers. We have a new fine system, not currently in place, which will penalise trusts and ensure that the monies that are generated by these fines go towards enhancing the general well-being and training of doctors within those trusts.
Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. Obviously, I'm disappointed that it's not the Secretary of State that we're speaking to today, but the Minister does refer again to weekend deaths. Could I gently point out that if the evidence from Fremantle is studied, there's actually a lower level of deaths at weekends, and maybe we could be a bit more precise that we are talking about people admitted at weekends who die within the next 30 days. I welcome the commitment to increase diagnostics and social care, and I think everyone within the NHS will. But junior doctors already work 7 days and 7 nights a week. So I really don't see how the junior doctors can actually be the barrier, in this case, to the safety of patients. I do think that looking back, the Secretary of State and indeed the Minister may regret how this was handled. Right from last summer, it has been so combative. In October, when we debated the junior doctors, the Secretary of State was still refusing to go to ACAS. So this cannot all be put on the BMA, and doctors are not stupid. They are capable of actually reading what was offered. Many of the junior doctors that have written to me have talked about the fear of hours getting out of control, and the fact that when I was a junior doctor and hours were ridiculous, it was the automatic financial penalty to trust that change things. I think it is important that their concerns are actually listened to and not patronised, as was the case on the Marr show yesterday. I think that has aggravated things further, and I think how this has been dealt with from beginning to end has been really disappointing. We're facing the second day of strike for the first time in 40 years, my entire career. What does the Minister feel is going to be brought to the table by the Department of Health in the next few days to try and get out of this and try and get a different approach. We don't have junior doctors on the streets in Scotland. You have to ask yourself, why do you have them on the streets here?
Here, here.
The Honourable Lady, who speaks from experience, rightly points to the fact that avoidable mortality attributable to weekends is different from mortality at weekends. And the Secretary of State has been very clear about that in the public statements that he has made. But it does exist, that gap, as she knows. Professor Sir Bruce Keogh has been clear in his statements about the fact that there is an avoidable rate of mortality. He calls it the weekend effect, which, he says, if addressed, could save lives. This is something that we as clinicians should collectively seek to solve. It also strengthens the moral and professional case for concerted action. I have to say to her that the way that she characterised the discussions in September and October and November are not, it's not quite right. We were imploring the BMA to come and talk. I personally had those discussions with leaders of the BMA, and they refused to do so. It was only when they came and talked to us that we have made substantive progress. Many of the issues she raised, she's absolutely right to raise them, and we wanted to discuss those with the BMA. One of them was around protecting for excess hours, but we had no counterparty with whom to negotiate. Since we had that counterparty, we have been able to have a really good series of moments of progress, and the result is this Guardian position, one that she welcomed in another place, and that Guardian will be able to levy fines, and the fines will be remitted to the Guardian. It's a process which I hope, well, in fact, and just hope it, I will expect, will reduce the excess hours which currently, I'm afraid, in a very small minority of positions are seen. What we need to do is get away from the perverse incentives, both for trusts and a very small minority of doctors, which means that unsafe working hours are perpetuated. Of course, we all regret the course that this has taken. I just have to tell her that it would not have taken this course had the BMA taken a responsible position right from the beginning. If you lie to your members, if you say that they are going to have a pay cut and their hours raised, of course doctors are going to be angry about it. All of us would be. But the fact is that was never true. And the result is that it's inflamed a situation where we could have had the kind of productive talks we've had over the last 3 or 4 weeks. We could have had those back in August, September and October had we not had all the mess beforehand because of untruthful statements issued by the BMA.
Helen Whately.
The level of support among junior doctors for this pay dispute is at least in part because of long-standing dissatisfaction with the experience of being a junior doctor. So David Dalton recommended a review of these long-standing concerns in his recent letter. Could my honourable friend advise whether the government intends to commission this sort of review?
I thank my honourable friend, and I can confirm that we will be looking at Sir David Dalton's recommendation and acting upon it. He is right to point to the fact the 1999 contract is an imperfect one. It was agreed back in 2008 that it had many failings and something needs to be done to fix it. And it is that contract in its generality which has helped contribute to the lessening of morale in the junior doctor workforce, and one that Sir David Dalton has recognised, as has the Secretary of State. Actually, it is not just in the way that training placements are put and a whole series of other problems with the contract. It's also the fact that you have very long periods of consecutive nights and days, all of which we brought down in the proposed contract that we have put in this latest iteration.
Mr. Dennis Skinner.
Is the Minister aware that it takes two sides to call a strike? Can't happen just because one side of the argument wants a strike. This Minister, the Secretary of State, has been looking for a fight with the doctors ever since he got the job. Does he realise that when I came here 45 years ago, I was getting time and a half for all day Saturday and double time like other miners for Sunday? The doctors, every time they are replaced by agency nurses, it's costing the government and the taxpayer a small fortune. Get the matter settled and be decent for a change.
The honourable gentleman has long prided himself as being a champion of working people, and yet the contract The current contract and the proposed contract by the BMA, that the Honourable Lady, I presume, supports, prefers junior doctors over porters, over cleaners, over junior nurses, giving them better pay rates, premium rates that could not be enjoyed by lesser paid workers under contracts negotiated by unions that he supports. So here we have it, the final morphing of the Labour Party into a party that prefers professionals over porters. And that, I'm afraid, is the party the honourable member is now a member of.
Dr. Andrew Murison.
I very much support the government's stance on junior doctors, whilst acknowledging that most doctors, junior and senior, work well beyond their contracted hours. But would he agree with me that it isn't junior doctors, but their seniors and their terms and conditions that really set the tempo in our National Health Service?
The honourable gentleman also speaks from experience. We've said right from the beginning that it is reform of consultants and junior doctors' contracts that is going to be critical to delivering 7-day services. And on consultants' contracts, it is important to make sure that consultants are providing cover, clinical cover, over weekends, not just for the benefit of patients, but also for juniors who are often covering rotas without the clinical cover from consultants to whom they might wish to confer and refer.
Ben Bradshaw.
Is it not, at the very least, odd, Mr. Speaker, that the Secretary of State yet again chooses to stay away and not come himself to answer questions on this very important subject before the House? I know as a former health minister how difficult the BMA can be, but this would seem to indicate to me that it's the Secretary of State who's become the main obstacle to a sensible solution to this crisis.
Just agree that.
Well, the right honourable gentleman will know that the previous Labour government numerically had far more scraps of the BMA than this previous coalition and this government have achieved so far. So he will know that this is something that is a mark of all health secretaries, to have disputes of one kind or another with the British Medical Association. He will be here tomorrow, since the honourable gentleman asks, able to answer his questions at Health Oral Questions.
Order. I'm sure that nobody who toddled into the chamber after the urgent questions started would expect to be called. That would be quite out of keeping with our parliamentary traditions. I think I need say no more. Mr. Crispin Blunt.
I wonder if the Minister can help me. The messaging I've heard from the BMA is that this dispute is nothing to do with pay. We've heard the issues described as a nut by the Shadow Secretary of State, yet it has led to a national strike for the first time for 40 years, or the second strike, and we're being faced with industrial action again. What is going on here?
Well, that is a question I'm increasingly asking of the BMA leadership. Because they have agreed with Sir David Dalton that the remaining issue is around pay. Having said it was not about pay for several months, they have now, in the end, come clean that it is about pay. And that is what we are dealing with about pay rates for plain time and for Saturdays, where they wish for preferred rates over nurses and other Agenda for Change staff.
Dr. Roberta Blackman-Woods.
Speaker, I would say to the Minister that junior doctors in my constituency are only very reluctantly taking action on Wednesday, but they are supported by many of my constituents who think it's simply a disgrace that they're being forced to take industrial action because the government is simply failing to address the legitimate concerns being raised by the BMA. Now, I heard the Minister say that his door was open, but can he say what he's actually going to do to settle this dispute? And does he think that it helps to denigrate the BMA in this chamber this afternoon?
The honourable lady said that junior doctors in her constituency had legitimate concerns. They did. And every single one of them has now been answered in the negotiations that have gone on between Sir David Dalton and predecessors, apart from one. And that one is the one that the BMA refuses to open negotiations on, despite having promised to do so in November of last year. So yes, our door remains open, but they first have to agree to talk to us, which they are, again, refusing to do so.
Mr. Alex Chalk.
Mr. Speaker, junior doctors in Cheltenham are some of the most dedicated and hard-working people anywhere in our local community. So it's of concern to me that some have cited information from the BMA suggesting that the government is proposing a pay cut. Can the Minister make the position crystal clear? Is that right?
No, it is not.
Mr Norman Lamb.
Thank you, Mr Speaker. Does the Minister ever wonder whether he's chosen the wrong target? He bases his entire argument on safety, and rightly so. And yet, chairs and chief executives of hospitals constantly tell me that they have no difficulty staffing their hospitals over weekends with junior doctors. And yet, at the same time, our GP out-of-hours services are under incredible strain. In many parts of the country, cover is threadbare. That surely is where the real safety concerns lie.
The Right Honourable Gentleman will know that we are looking at the contracts for GPs and for consultants and for junior doctors. They are of a piece. You cannot see one clinical group in isolation. They work together. And he should know, therefore, that in concluding discussions with junior doctors, with consultants and with GPs, we need to make sure that we give hospitals and primary care settings the ability to be able to roster staff consistently through 7 days of the week.
Maria Caulfield.
Mr Speaker, I've met with junior doctor colleagues over the last few weeks and months, many of whom are cautious about the new contract, but strike action is the absolute last resort and they would rather not take it. I met with a constituent myself this morning from Polegate, whose operation is going to be cancelled this week thanks to the strike action, and I welcome the Minister's comment that the door's still open, even at this late hour, to call off the strike. Would he not find it helpful for the Shadow Secretary of State to also condemn the strike and ask doctors to call this off so patients aren't the real losers in this dispute?
Well, my honourable friend points to an interesting fact, that despite these many months of discussions we've had, we have never had a clear line from the Shadow Secretary of State or the opposition about whether they condemn or support the industrial action. And to do so would be quite helpful, because at least we would know whose side they are on, whether they're on the side of patients, whether we are trying to eliminate the weekend effect, or whether they're on the side of the leadership of the BMA.
Angela Rayner.
Thank you, Mr Speaker. I find it really unfortunate, the language and the tone from the Minister opposite in regards to the BMA and these doctors, as if they don't care and they don't want to help their patients. I find that really regrettable. And also, in my time as a Unison official, when I used to represent public sector workers in the healthcare sector, the BMA was hardly known as the militants in that organisation, so you need to reflect upon that. Could I ask the Minister, really, does he really think, as my friend from Bolsover said earlier, that this is all the blame of the BMA and the doctors? Doctors care about their patients. That's why they're in this position. Do you not accept any responsibility for the impasse?
I agree entirely with the Honourable Lady about the passion and dedication of junior doctors, and never once has the Secretary of State or I questioned that. What we have questioned are the tactics of the leadership of the BMA. And I also happen to agree with her about her previous employer, Unison. I have constructive relationship with Unison. I disagree with them, they with me, often. But we agree on many things, and we have a very straightforward relationship. But with the BMA, I'm afraid, it is difficult to do business when they promise to talk about one thing and then refuse to a few weeks later, when they refuse to come to the negotiating table for months, and when they mislead their members in a way that Unison, I don't think, ever has done.
Maggie Throop.
Speaker. The residents in my constituency tell me two things. First of all, just how much they value the work of doctors, both junior doctors and consultants. But secondly, just how disappointed they are that we are not united in this House in saying that the strike is just not justified on health and on safety grounds. Is the Minister as disappointed as my residents?
And I would say to my honourable friend, the 2,800 people who have had cancellations to their operations. And I wonder what answer they get from the opposition about whether the opposition supports that cancellation or whether they condemn it. And as soon as we have an answer to that very simple question, I think it would be easier for us to know about the official position of Her Majesty's opposition.
Julie Cooper.
Thank you, Mr Speaker. Yesterday, the Secretary of State for Health accused the BMA of misleading junior doctors. Today, the Minister comes to the House and adds to that, he accuses the BMA of lying. Is he really asking this House to believe that some of the most intelligent people in the country, the junior doctors, really cannot see what the government is proposing for themselves? And does he feel that this continued abuse that's being directed at the junior doctors' representatives is hindering any possibility of a settlement of this dispute, which is damaging to patients?
The Honourable Lady is also an intelligent woman, so I will ask her this. If a trusted body like the BMA tells its members that they will have a pay cut of 30% and an increase in hours, and that statement is incorrect, does it constitute a lie? And that is the question I would put back to her.
Mr. Stuart Andrew. Thank you, Mr. Speaker. A number of colleagues met with the BMA here in this Parliament, and we were disappointed that, despite continued questioning, they refused to actually go to the negotiating table. Thankfully, they eventually did and made some progress. My constituents want a safe 7-day NHS. Isn't it time they get back around the table so that we can provide the service that NHS patients want?
It is, and that's why I say to my honourable friend, that's why we need to move ahead with this in fairly short order, because in the end, the people who will suffer most from not making reform to staff contracts across the service will be patients and the consistency of care that they receive at the weekends.
Margaret Greenwood.
Thank you, Mr. Speaker. The Shadow Health Secretary asked the Minister if he could list the hospitals which currently don't have enough junior doctors working at the weekends. He couldn't answer that question, so here's another chance. Will he name them for us now?
In evidence given to the Doctors and Dentists Pay Review Body, it was clear that rostering was made more difficult by the current plain time terms within the contract. So that is why it's been on the table now for several years. It's why it's been formed part of the discussions when we've been able to have them with the British Medical Association. And it's why in the latest round of talks, led by one of the leading chief executives in the country, Sir David Dalton, he has pressed the BMA to come and talk about Saturday specifically and about plain time in general, and the BMA has refused to speak about both.
Mr. Richard Drax.
Mr. Speaker, whatever the arguments of this case, I can think of no one more honourable, decent and honest to run the negotiations than my right honourable friend, the Secretary of State. It's reported that graduating medical students applying to be Foundation Year 1 and 2 junior hospital doctors are seeking work in Northern Ireland, Scotland and Wales to avoid the new contract. Is this true? And if it is, what can be done to stop this drain of our best medical students?
We don't see any particular evidence of movement in juniors at the moment, but the best thing we would like to see for juniors is the new contract introduced so they can see that it's going to be better for their working practices than the current one. It is in all of our interests, not just juniors but also patients, to make sure that juniors are working safe hours, which is why the new contract has got reductions in consecutive nights and long days, and it's why we want to reduce and eliminate the excessively long hours in the week.
Mr. Christian Matheson.
Sir, I'm sure that the ministers have a very good idea, a very clear idea of how their proposals will affect working practice. So can I ask the Minister, on how many occasions last year did a junior doctor work 91 hours or more a week?
We believe that there are about 500 junior doctors who, the course of last year, were operating on a Band 3 payment, which equates to the payments above the working time regulations. So it's a relatively small number within the NHS, but it's still significant, and for those doctors who are working those excessive hours, it is unsafe.
Mark Spencer.
Thank you, Mr. Speaker. Will the Minister join me in thanking those junior doctors who ignored the call for strike last time during the industrial action? And will he also agree with me that the lack of condemnation from the opposition over the industrial action means that they're putting their support of industrial action in front of my constituents and their healthcare needs?
Well, I completely agree with my honourable friend. Rather like an arsonist pouring petrol on a fire and then running to offer help to put it out, the opposition has done very little to help get this contract into a place that it needs to be and stop industrial action. And I'm afraid that those patients who are going to have cancelled operations this week are partly to suffer because of the opposition's failure to take a firm stand on this issue.
Fiona McTaggart.
The Minister will be aware that Wexham Hospital in Slough has been enormously improved in the quality of care that it gives to its patients. It's done that with the same staff, but with a leadership which says to the people who are working in the hospital that they have confidence in them, that they share values. And yet this Minister is saying that he is the only person who cares about patient safety and suggesting that doctors don't. What does that do for morale and their ability to improve the quality of care for patients?
I'm not sure how to answer the honourable lady's question, seeing as she wilfully misconstrued what I had said. I've never once suggested that it is only the government that cares for patient safety. Almost every doctor out there cares for nothing other than patient safety and patient care. But I have to say to her that if we're going to get consistent levels of care across the weekend, according to the Royal Academy of Medical College's 10 clinical standards, part of that is going to be achieved by reform of staff contracts, and one of those is with junior doctors, and that is why we must press ahead with it.
Wendy Morton.
Thank you, Mr. Speaker. I'd like to start by commending my honourable friend for all the work he's doing to deliver the truly 7-day-a-week health service that I know that not just members of my constituency will benefit from, but each and every one of us in this chamber. I am a little surprised, though, that the honourable lady opposite said no one is saying the existing contract is perfect. Would he not agree with me that we should all be working together in the interests of our constituents to bring this situation to a successful conclusion, and that rather than playing political points with it?
Well, I agree with my honourable friend, and I'm afraid it is a rather mark of the way the Labour Party has changed, that I suspect had there been a Labour Party of a different era, one that was rather more responsible about the way that it dealt with industrial disputes, that they would have seen on whose side they should be acting at this point.
Nick Dakin.
Mr. Speaker, of course it's a Conservative government, and to have a strike of this sort on a government's watch is a disgrace and a failure. And really, I've listened to the Minister, and I quite like the Minister actually, but he's only ever laid the blame elsewhere. Surely a government should be evaluating its own performance and saying we can do better than this, we can make sure this doesn't happen even at this 11th hour.
Well, the honourable gentleman tempts me with kindness, and I repay the compliment, but all I can say to him is that having been involved in this process for some months now, I have found it incredibly frustrating. Every time we have asked the BMA to come and talk up until the end of November, they have refused, despite personal entreaties. And when they did talk, you often find that you had nailed down an agreement only to find it slipping out of your fingers the next day in front of the media. It has been a hugely frustrating process for everyone concerned, and it's why it's been such a difficult process, not just for us, but for junior doctors who have been left confounded and confused by the whole thing.
Dr. Tania Mathias.
Thank you, Mr. Speaker. Would the Minister agree with me that junior doctors, most of them, if not all, exceed their contracted hours, and therefore the 72-hour limit is essential? And will he acknowledge, even after, when I hope these negotiations are complete, there will be many junior doctors exceeding their contracted hours?
There are some junior doctors who exceed their contractual hours. The average across the service is 48 hours, but some are exceeding it to the number of 91, which is the currently permitted limit outside the Working Time Directive. And we wish to stop that altogether and bring it down to an absolute maximum of 72 hours in a week, which would equate in the end to a 48-hour average over the period that it's looked at, currently 6 months. The key is to get the number of hours down, because when you're working excessive hours, it's unsafe for patients and for doctors.
Mr. Barry Gardner.
Thank you, Mr. Speaker. The Minister has been keen to establish what he sees as the preferential terms and conditions that junior doctors enjoy. Yet Sir David Dalton, in his interview with the Health Service Journal, said, "My assessment is that the staff group that will have to contribute the least above that which they are providing at the moment would be our doctors in training." He says, "Our messaging on this has got muddled." Does the Minister agree?
Sir David Dalton is also clear that we have to reform all contracts. Now, you can place the balance where you wish, but it is important that we actually reform the juniors and the consultants' contracts together so they can fit of a piece within the service. It is wrong, for instance, to be able to have a junior on duty taking decisions at the weekend not covered by consultants who are able to supervise and help with that decision. And we need to make sure there's consistency of rostering through the week and weekend involving both juniors and seniors.
Mr. Robert Jenrick.
Mr. Speaker, I represent many junior doctors. I've met them and I've tried to represent their views to the government. But I've always taken the view that my primary responsibility is to the patients of the NHS. And one of those patients, my constituent, emailed me this week to say that one of the consequences of this strike will be the cancellation of his wife's biopsy planned for next week, which he writes, "Without this, her already shortened and difficult life will be even shorter." Will the Minister, the Shadow Minister and the whole House join me in condemning this strike? It will achieve nothing. It is a distraction from the negotiations that need to continue and will put the lives of my constituent and others across the country at risk.
I can't possibly add to the comment of my honourable friend, and I just hope the Shadow Secretary of State takes note.
Liz McInnes.
Thank you, Mr. Speaker. Strike action is always a last resort, and I can say categorically as an ex-NHS worker that no NHS worker wants to go on strike. And what we have here is a complete failure of negotiation. The Secretary of State's door may be open, but the inflammatory and frankly insulting comments he made on the media this weekend do not exactly invite people to cross that threshold and talk to him. Given that he has manifestly failed as a negotiator, isn't it about time he stood by, he stood aside and lets a trained negotiator deal with the BMA and come to an agreement before it's too late?
I'm not sure the Honourable Lady's been listening to the statements made in this House and elsewhere. Well, I'm not sure she has been listening, because she would have heard that the negotiations already have been taken on by leading negotiators from NHS employers, and latterly by Sir David Dalton, one of the leading chief executives in the country. And significant progress has been made, contrary to what she has just suggested. Negotiations have worked. We have managed to nail down... She shakes her head, but the fact is that Sir David Dalton has managed to secure agreement on every single point of contention other than pay rates for plain time, unsocial hours and on Saturdays. So this dispute on Saturday and the kind of results that we are going to see across the country on Wednesday will essentially be around pay rates on a Saturday, for which the BMA wants preferential rates over nurses, porters, cleaners and other workers in the NHS.
Mr. Ben Howlett.
Mr. Speaker, may I join colleagues in thanking the Minister and the Secretary of State for all their work in negotiating a contract, which is obviously quite a tough discussion. While many of my constituents may have sympathised last year with the BMA's case, patients and their families, including my own father after a recent heart valve replacement job, will be concerned that the BMA is not getting around the negotiating table, placing an awful lot of undue stress on the most vulnerable. Will you agree with me that the BMA should seriously consider those patients as they protract their negotiations?
If the BMA were truly representing its members, they would be thinking about the patient welfare during the strikes, and we've heard with great eloquence just now about the kind of effects on an individual level that a strike will cause. The strikes will get us no nearer to a solution. The only way to come to a solution here is by negotiation.
Matt Warman.
Mr. Speaker, it is testament to the progress being made over the course of these negotiations that the BMA has cancelled some strikes and indeed downgraded the one that we are expecting on Wednesday. But does my honourable friend agree with me that one crucial thing that would make a greater difference would be condemnation from the other side of this House?
Yes, where is it?
I think it would make a significant difference, actually, and now that the Leader of Her Majesty's Opposition is sitting on the front bench, he might like to take note. But the fact is that if you have a united political response condemning strikes which affect patients and their safety, it helps to bring negotiations to a more profitable end.
Diana Johnson.
Speaker, Hull Royal Infirmary is currently under a black alert, which means local people have been told not to attend the hospital unless it's a matter of life or death. So can the Minister tell me how the insults that the Secretary of State has been throwing around over the weekend, and also the insults the Minister has made today about hard-working and dedicated junior doctors, will help people in Hull who need a functioning NHS and also improve the morale of those doctors?
The Honourable Lady does dangerous work if she tries to conflate the comments that I and others have made about the leadership of the BMA with the motivations of junior doctors, none of whom I have impugned. The fact is that I recognise that junior doctors work incredibly hard, that they care passionately about their patients, and that they have a vocational drive to do the best for the people they care for. But that is different from an organisation which refuses to talk, refuses to negotiate, lies to its members, and is very slippery in the statements it puts out to the press.
Philip Holloway.
Kettering General Hospital is always under huge pressure, and the junior doctors at the hospital do a fantastic job. But may I tell the Minister that my constituents will be extremely disturbed to hear him tell the House today that at the ACAS talks, the BMA said they would negotiate about Saturday pay and are now refusing to do so, and the consequence will be a strike on Wednesday, and my constituents are appalled that 2,884 operations have already been cancelled, with that number possibly going even higher.
My honourable friend is right, and it's one of a number of agreements that we have come to with the BMA over the course of these discussions, which have subsequently been reneged upon by the organisation. It's why this whole process has been so torturous for everyone involved.